welcome to today's topic, which is adjustment problems of students with attention deficit hyperactivity disorder, also called ADHD. And the objectives set for today's lecture are to know the meaning and concept of ADHD, to get acquainted with types of ADHD, to list out different characteristics of children with ADHD, to know about adjustment problems faced by children with ADHD, and to know about different strategies of teaching children with ADHD. First, introduction. Attention deficit hyperactivity disorder means ADHD is the most common psychiatric problem diagnosed among children. It has become a major health and social problem. Attention deficit hyperactivity disorder is one of the most common mental disorders affecting children. ADHD also affects many adults. Symptoms of ADHD include inattention, meaning not being able to keep focus. Hyperactivity, excess movement that is not fitting to the setting, and impulsivity, hasty acts that occur in the moment without thought. ADHD is often first identified in school-aged children when it leads to disruption in the classroom or problems with schoolwork. It can also affect adults. It is more common among boys than girls. Many ADHD symptoms such as high activity levels, difficulty remaining still for long periods of time, and limited attention spans are common to young children in general. The difference in children with ADHD is that their hyperactivity and inattention are noticeably greater than expected for their age and cause distress and or problems including functioning at home, at school, or with friends. Although the symptoms of ADHD being in childhood, ADHD can continue through adolescence and adulthood. Even though hyperactivity tends to improve as a child becomes a teen, problems with inattention, disorganization, and poor impulse control often continue through the teen years and into adulthood. Children with ADHD may also struggle with low self-esteem, troubled relationships, and poor performance in school. Symptoms sometimes lessen with age. However, some people never completely outgrow their ADHD symptoms, but they can learn strategies to be successful. Now, what is the concept of ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder. It is a medical condition. Attention Deficit Hyperactivity Disorder, as defined by the Diagnostic and Statistical Manual of Mental Disorders, American Psychiatric Association 2013, is a persistent pattern of inattention and or hyperactivity, impulsivity that interferes with functioning or development. It has been described as the most common neurodevelopmental disorder of childhood and one of the most common chronic health conditions affecting school-aging children. A person with ADHD has differences in brain development and brain activity that affect attention, the ability to sit still, and self-control. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention, controlling impulsive behaviors, means may act without thinking about what the results will be, or be overly active. It is normal for children to have trouble focusing and behaving at one time or another. However, children with ADHD do not just grow out of these behaviors. The symptoms continue, can be severe and can cause difficulty at school, at home, or with friends. ADHD may be defined as: ADHD is a developmental impairment of the brain executive functions. People with ADHD have trouble with impulse control, focusing, and organization. A child with ADHD might daydream a lot, forget or lose things a lot, squirm or forget, talk too much, make careless mistakes, or take unnecessary risks, have a hard time resisting temptation, have trouble taking turns, have difficulty getting along with others. Now, what are the characteristics of children with ADHD? Number 1, they are self-focused. Children with ADHD have inability to recognize other people's needs and desires. Number 2, they are interruptive. Self-focused behavior may cause a child with ADHD to interrupt others while they are talking or into a conversation and games they are not part of. Next is trouble waiting their turn. Children with ADHD may have trouble waiting their turn during class activities or when playing games with other children. Next is emotional turmoil. These children may also have trouble keeping emotions in check. They may have outbursts of anger at inappropriate times. Younger children may have temper tantrums, means emotional outbursts of frustration. Next is forgetting. Children with ADHD often can't sit still. They may try to get up and run around, forget or squirm in their chair when forced to sit. Next is problems playing quietly. Forgettiness can make it difficult for children with ADHD to play quietly or calmly in leisure activities. Next is unfinished tasks. A child with ADHD may show interest in a lot of different things, but they may have problems finishing them. Next is they have lack of focus. Children with ADHD have trouble paying attention even when someone is speaking directly to them. Next is avoidance of tasks needing extending mental effort. The lack of focus can cause a child to avoid activities that require a sustained mental effort, such as paying attention in class or doing homework. Next is mistakes. Children with ADHD may have trouble following instructions that require planning or executing a plan. This can lead to careless mistakes, but it doesn't indicate laziness or a lack of intelligence. Next is trouble getting organized. Children with ADHD may have trouble keeping track of tasks and activities. This can cause problems at school as they can find it hard to prioritize homework, school projects, and other assignments. Next is forgetfulness. Kids with ADHD may be forgetful in daily activities. They may forget to do chores or their homework. They may also lose things often, such as toys. Thus, a child with ADHD can show symptoms in multiple settings, means they may show lack of focus both in school and at home. Now, what are the types of ADHD? ADHD is often first identified in school-aged children. A key sign is when their behavior becomes disruptive and they show signs of not being focused, making impulsive decisions, and being hyperactive. ADHD is more common in boys than girls. There are three main types of ADHD which differ according to the symptoms that present most commonly. It is characterized majorly under three main categories. Number 1, ADHD combined presentation. Number 2, ADHD predominantly impulsive hyperactive. Number 3, ADHD predominantly inattentive. Now, number 1, ADHD combined presentation. This is most common type of ADHD. This person shows impulsive and hyperactive behavior as well as getting distracted easily and struggling to maintain attention. People with combined type ADHD demonstrate 6 or more symptoms of inattention and 6 or more symptoms of hyperactive and impulsivity. Next is ADHD predominantly impulsive hyperactive. This is the least common type. The person shows signs of hyperactivity and the need to move constantly as well as displaying impulsive behavior. They do not show signs of getting distracted and inattention. Children often appear to act as if driven by a motor and run around excessively. People of all ages may talk non-stop, interrupt others, blurt out answers, and struggle with self-control. This type of ADHD is more recognizable and more often diagnosed in children and men. ADHD predominantly inattentive. People with this type of ADHD do not exhibit signs of hyperactivity and impulsivity. Instead, the person gets distracted easily and finds difficult to pay attention. People with inattentive ADHD make careless mistakes because they have difficulty sustaining attention, following detailed instructions, and organizing tasks and activities. They have weak working memory and easily distracted by external stimuli and they often lose things. This type of ADHD is more commonly diagnosed in adults and girls and was formerly known as ADD. The predominantly inattentive type is the one often referred to as ADD, standing for Attention Deficit Disorder. As the term does not contain the word hyperactivity, the disorder was described as ADD before the word hyperactivity was added in 1987. Essentially, ADD is now an outdated way to refer to ADHD. Now, dear students, let us know about the adjustment problems of children with ADHD. Attention Deficit Hyperactivity Disorder, often referred to as hyperactivity, is characterized by difficulties that interfere with effective task-oriented behavior in children, particularly impulsivity, excessive or exaggerated motor activity such as aimless or haphazard running or forgetting, and difficulties in sustaining attention. Children with ADHD seem to have particular difficulty controlling their activity in situations that call for sitting still, such as in the classroom or at meal times. When required to be quiet, they appear unable to stop moving or talking. They are disorganized, erratic, tactless, obstinate, and bossy. Their activities and movements seem haphazard. They quickly wear out their shoes and clothing, smash their toys, and exhaust their families and teachers. They are difficult, however, to distinguish from children without ADHD during free play when there are fewer restrictions placed on behavior. Children with ADHD are mostly emotionally less mature and less adjustment than normal children. They mostly lack independence, which means they show parasitic dependence on the others, egoistic, and lack objective interest. Besides that, children with ADHD are socially maladjusted, very destructive in nature, acting without thinking, and poking others for no apparent reason. ADHD children are highly disorganized and they are impulsive as well as hypersensitive. The various adjustment problems faced by children with ADHD are: number 1, socially maladjusted. Children with ADHD are highly disorganized and they are impulsive as well as sensitive. They often act before thinking, creating difficult social situations in addition to problems in the classroom. Children with ADHD have poor social adjustment than the normal children. They are more submissive and retiring. Due to their inability to regulate socially desirable behavior, these children often face conflict with family and increased conflict with peers. They display more social skill deficit and often viewed as intrusive, loud, annoying, and generally aversive by their peers. They are more rejected and less accepted by their peers and have fewer dyadic friendship. Number 2 is emotionally immature or unstable. Children with ADHD have difficulty in controlling their emotions in difficult situations. They do not meet society's expectations for social behavior within their age range. When they get bored or people do not pay attention to them and act in an unpredictable ways, they might burst into tears when something goes wrong or get clingy when they are feeling insecure. Number 3 is personality disintegration. It means children with ADHD have problems such as phobias formation, rationalization, pessimism, immortality, etc. Emotional difficulties include poor emotional self-regulation, aggressive and reduced empathy. Number 4 is lacking independence. Children with ADHD show parasitic dependence on other, egoistic and lack objective interest. They are always dependent on others, which result in serious academic and social or interpersonal impairment at home, at school, and other settings as well. These children may become so easily distracted by noise, passerby, or their own thoughts that they often miss vital classroom information. These children may have trouble staying focused or tasks that require sustained mental effort. They struggle with controlling their impulses, so they speak out of turn. In the classroom, they may call out or comment while others are speaking. Their outbursts may come across as aggressive or even rude, creating social problems as well. The self-esteem of such children is often fragile. Next is adjustment problems at school. At school, students with ADHD are often inattentive, disorganized, off-task and disruptive, which often leads to low rates of work completion both in class and at home. ADHD can affect a student's ability to focus, pay attention, listen or put effort into schoolwork. ADHD also can make a student fidgety, restless, talk too much or disrupt the class. Children with ADHD might also have learning disabilities that cause them to have problems in school. Since students with ADHD are often in trouble, they are unable to deal with criticism and can become defiant and hostile. This can damage their whole attitude to school and to learning, and they may ultimately give up on education. It's very important to show that education has not given up on them. The impact of ADHD goes beyond inappropriate behavior and problems at school. ADHD is a developmental condition that presents difficulties for students and those around them. A diagnosis of ADHD will often lead to students being labeled as difficult, demanding, and defiant, and stigmatized to a greater or lesser extent. Students with ADHD stand out from their peers and can struggle to fit in at all stages of development, and the impact of the condition and diagnosis can extend to their families and carers. Now, adjustment problems with teachers. Students with ADHD can be understandably quite frustrating for their teachers. Without knowing that ADHD is a biological condition, teachers do not deal with patience and understanding with these children. ADHD causes students to struggle with attentiveness, focus, and organization. These students are often highly impulsive, hyperactive, and distractible. They may struggle to complete tasks and often lose or misplace items. This restless inattentiveness often leads to frustration and inappropriate behavior in the classroom, which can be a serious problem for teachers as well as other students. Students with ADHD do not excel in situations requiring extended seat work or prolonged quiet focus. Lessons may need to be modified to accommodate these students' needs, which become challenging for a teacher. Next is strained parent-child relationship. Parents living with a child with ADHD experience stress as they struggle to cope with the child's symptoms amidst the stigmatizing attitude from family and community members. The parents of such children feel burdensome emotions and impaired social and impaired functioning. So, due to their defiant and aggressive behavior, they are not accepted as such by parents, which lead to relationship difficulties. Children with ADHD create far more demands on parents' time and attention. That can lead to relationship problems, less family togetherness, and more conflict. Thus, the most common problems in children with ADHD are defiant and aggressive behavior. This includes refusing, more often than other children, to follow directions from parents or teachers. They may have emotional outbursts when asked to do things they find difficult or challenging. Now, teaching children with ADHD. Inattention, hyperactivity, and impulsivity are the core symptoms of attention deficit hyperactivity disorder. A child's academic success is often dependent on his or her ability to attend to tasks and teacher and classroom expectations with minimal distraction. Such skills enable a student to acquire necessary information, complete assignments, and participate in classroom activities and discussions. When a child exhibits behaviors associated with ADHD, consequences may include difficulties with academics and with forming relationships with his or her peers. Inappropriate instructional methodologies and interventions are not implemented. There are many ways to teach a student with ADHD. Some of them are: the first major component of the most effective instruction for children with ADHD is effective academic instruction. Teachers can help prepare their students with ADHD to achieve by applying the principles of effective teaching when they introduce, conduct, and conclude each lesson. Students with ADHD learn best with a careful, structured academic lesson, one where the teacher explains what he or she wants children to learn in the current lesson and places these skills and knowledge in the context of previous lessons. Effective teachers preview their expectations about what students will learn and how they should behave during the lesson. According to Dr. Zentel, children with ADHD seek change, novelty, and high interest activities. They do best with an engaging, active curriculum at school or an active home environment. Incorporating physical movement and motor activities throughout the day increases successes. It is important for a teacher to understand the struggle of a student with ADHD and provide an ordered, safe, predictable classroom environment. Teacher must establish a courteous working relationship with the student, parents, and learn about their child's strengths, weaknesses, interests, and achievements outside of school. Effective teaching methods must be used to ensure the success of such children. Communicate often and send encouraged notes home. Teachers should make time to speak to the students individually. They must be respectful and express interests in his or her success in school by asking how he or she learns best. The teacher should stress to make classroom rules clean and concise. They should discuss them orally and post them for each reference. The consequences for misbehavior should be explained in understandable terms and enforce them consistently, and power struggles should be avoided. The lessons should be divided into relatively short segments, and a variety of teaching aids such as films, tapes, computer programs and small group work should be used to reinforce the child's learning. Students with ADHD should be given opportunities to display his or her skills, talents and leadership abilities. The behavioral classroom management approach encourages a student positive behavior in the classroom through a reward system or a daily report card, and discourages their negative behaviors. This teacher-led approach has been shown to influence students' behavior in a constructive manner, increasing academic engagement. Although tested mostly in elementary schools, behavioral classroom management has been shown to work students of all ages. Thus, a student with ADHD can present unique challenges in the classroom. Inattention, hyperactivity or impulsivity can be the source of frustration, but there are ways teachers can help students with ADHD to improve the educational experience and control the symptoms of the disorder. It is important for teachers to be aware of coexisting conditions such as learning disabilities, as well as reinforcing the importance of classroom and instructional structure. Now, dear students, let us conclude. Attention deficit hyperactivity disorder has become a major health and social problem. It is a most common psychiatric problem diagnosed among children. ADHD is associated with a wide range of adverse psychosocial problems throughout the span of life. It has caused a burden on various resources of India like medical resources, psychological resources and societal resources. Children with ADHD and conduct disorders have behavior, academic and peer problems, which often causes serious impairment in academic performance, social, adaptive and behavioral functioning both inside and outside the home. The cognitive and emotional characteristics associated with ADHD in children have been identified as risk factors for the development of diverse adjustment problems in the school context. Since students with ADHD are often in trouble, they are unable to deal with criticism and can become defiant and hostile. This can damage their whole attitude to school and to learning, and they may ultimately give up on education. It is very important to show that education has not given up on them. Children with ADHD struggle more with boredom and putting mental effort into challenging tasks. Virtual learning or in-person schools with more rules may lack the novelty and excitement that keeps children with ADHD from being bored and keep them engaged in learning. Children with attention deficit hyperactivity disorder experience more obstacles in their path of success than the average student. The symptoms of ADHD, such as inability to pay attention, difficulty sitting still, and difficulty controlling impulses, can make it hard for children with diagnosis to do well in school. Thus, children with ADHD suffer from gross problems in adjustment, which need special attention. Dear students, this was all about adjustment problems of students with ADHD. Hope you understood well. Thank you.